Contraceptive methods. Which is the right one for you? Hi, my name is Annette Gonzalez, and I am a family nurse practitioner student at the University of Texas at El Paso. Today I would like to talk to you a little bit about the different types of birth control methods that are available to you before you come in and see me. Enjoy the video. What is right for me? When it comes to contraception, you need to decide which method is the best for you. There are some questions you should ask yourself to find the right method for you. Before deciding on birth control, there are some questions you should ask yourself. How important is it to me that I don't get pregnant right away? Is this contraceptive method safe for me? How does my partner feel about birth control? Is this method easy to use? Will I feel embarrassed about using this birth control? Do I need a method that helps in protecting me from HIV or other STDs? How much will this method cost? How do I feel about touching my own body? Do I have religious feelings about using birth control? How often do I have intercourse? So let's begin with talking about the pill. The pill releases artificial hormones to stop ovaries from releasing egg, and it also thickens mucus in the cervix, so it is hard for the sperm to enter the cervix. So how is it used? Well, you should take your pill every day at approximately the same time each day. If the pill is used correctly, it has a 99% rate of effectiveness. The actual failure rate of 2% to 3% is due primarily to missed pills or failure to resume therapy. The benefits of the pill is that the periods are predictable, shorter, and less pain, and the risk of iron deficiency anemia is reduced. It also reduces the chance of getting ovarian cancer and endometrial cancer. It also helps prevent benign breast and ovarian disease and PID, or pelvic inflammatory disease. The risks associated with a pill is that it does not protect against HIV or other sexually transmitted diseases. It can also have breakthrough bleeding. It is contraindicated in women over the age of 35 who smoke or who have a thromboembolism, and in women with history of coronary artery disease, congestive heart failure, cerebrovascular disease, or migraines with or without auras. There's also the patch. The patch releases artificial hormones to stop ovaries from releasing egg and thickens mucus in the cervix, so it is hard for the sperm to enter the cervix. So how is it used? The patch is applied once a week for 3 weeks. And during the 4th week, no patch is used. If the patch is used correctly, there is an effectiveness rate of 99%. The good points about the patch is that it is simple and easy to use. It does not interfere with sexual intercourse. There is less bleeding and cramping during periods. Can be worn on clean, dry skin located either on the buttocks, upper arms, and lower abdomen. The risks associated with using the patch is that it does not protect against HIV or other sexually transmitted diseases, and it should be used with caution on patients weighing more than 198 pounds because obesity decreases the efficacy. Skin irritation from adhesive residue at the application site is also possible. There is also the vaginal ring. It also releases artificial hormones to stop ovaries from releasing egg and thickens mucus in the cervix, so it is hard for the sperm to enter the cervix. So how is it used? Well, the vaginal ring you need to use each month, and it is inserted into the vagina and left in for 3 weeks. During week 4, you do not wear the ring. If used correctly, it is 99% effective, comparable with oral contraceptive pills in efficiency. The ring is associated with greater compliance because of its once-a-month usage. The good part about the vaginal ring is that it is simple to use. Most patients and partners are not aware of the ring due to its small size of 2 inches in diameter. It is colorless and odorless. The downfall about the vaginal ring is that it does not protect against HIV or other sexually transmitted diseases. Also, metabolism still occurs in the liver, therefore caution should be used. There are also barrier methods that can be used as birth controls. There are condoms, diaphragms, foams, suppositories, and films. The condom can be used by either a male and a female. The male condom fits over the erect penis and catches sperm when the man ejaculates or comes. It is also known as rubbers. The female condom is a sheath that is placed inside the vagina to prevent sperm from reaching the cervix and upper genital tract. So how is the male condom used? Well, a new one must be used every time you have sexual intercourse. In the female, also a new one must be used every time you have sexual intercourse. If the condom is used correctly, it has a 98% effectiveness rate. What is good about the condom that it is widely available and inexpensive. It is easy to use and you only use it when you need it. Only latex condoms help protect you against HIV or other sexually transmitted diseases. The downfall about the condom is that it must be put on during sexual intercourse, and condoms may irritate the vagina or penis. There's also the diaphragm. The diaphragm is a small rubber cup that fits inside the vagina over the cervix and is used with contraceptive cream or jelly that kills the sperm. It must be used every time you have sexual intercourse, and fresh spermicide must be applied each time. If used correctly, it is 94% effective. It can be put in 6 hours before sexual intercourse, and it is only used when needed. The downfall about the diaphragm is that it does not protect against HIV or other sexually transmitted diseases. There's also an increased risk for UTIs, increased risk for E. coli infection due to the spermicide, and some women report that it is hard to put on and take off. It can be messy. The cream and jelly may irritate the vagina or penis and must be left in place 6 hours after sexual intercourse. The foam or the sponge is a small pillow-shaped sponge containing spermicide. It has a dimple that is designed to fit over the cervix. It must be worn each time you have sexual intercourse and is made of chemicals that kill sperm. It has an 82% effectiveness rate. It is easily available, it is easy to use and to carry, and it is only used as needed. The downfall about it is that it does not protect against HIV or other sexually transmitted diseases, and it is only available in one size. So it is more effective in newly paired women or women who have not had children than one who has had children in the past. There is also risk for toxic shock syndrome if left in place for longer than 30 hours. The suppositories is another form of contraception. It must be inserted and placed inside the vagina before sexual intercourse. It must be worn each time you have sexual intercourse, and it is made of chemicals that kill sperm. There is an 82% rate of effectiveness. The good part about the suppository is that it is easy and available. It is easy to use and carry. It is only used as needed. The downfall about it is that it does not protect against HIV or other sexually transmitted diseases. It can irritate the vagina or penis and can be messy and must be put on shortly before sexual intercourse. The film must be inserted and placed inside the vagina before sexual intercourse. It must be worn each time you have sexual intercourse and is made of chemicals that kill the sperm. There is also an 82% effectiveness rate. The good part about the film is that it is easily available, it is easy to use and carry, and it is only used as needed. The downfall about the film is that it does not protect against HIV or other sexually transmitted diseases. It can irritate the vagina or penis and can be messy, and it must be put on shortly before sexual intercourse. So now let's talk about IUDs or intrauterine devices. The Mirena IUD is a small T-shaped device that is inserted into the uterus and releases hormones. It prevents the sperm and egg from meeting. It also thickens the cervical mucus and creates an unfavorable uterine environment. The Mirena is inserted in the uterus through the cervix and can be in the uterus for as long as 5 years, no more than that. The Mirena has a greater than 99% effectiveness rate. The good parts about the Mirena is that it provides continuous pregnancy prevention. It also helps treat heavy bleeding, and it may cause light periods or even eventually no periods at all. It can help protect against PID or pelvic inflammatory disease. The downside about the Mirena is that it does not protect against HIV or other STDs. It should not be inserted in women at high risk for sexually transmitted diseases. It can cause infection due to possible bacteria from cervical-vaginal flora during the introduction of the IUD into the cervix. There is another form of IUD called the Paragard. It is an IUD that is a hormone-free birth control method. It is wrapped with copper wire coils that continuously release copper to bathe the lining of the uterus. It produces an inflammatory reaction in the uterus that is toxic to sperm, and if fertilization were to happen, then it keeps the fertilized egg from implanting in the lining of the uterus. So how is it used? Well, the Paragard is also inserted into the uterus through the cervix. However, this one can last up to 10 years. The Paragard has an effectiveness rate of greater than 99%. The good points about the Paragard is that it is a long-term birth control method, and it does not use hormones to provide birth control. The downside of the Paragard is that it does not protect against HIV or other sexually transmitted diseases. Another form of birth control is the implanon. It is an implantable rod that goes under the skin of the arm. It thickens the mucus in the cervix, so it is hard for the sperm to enter the cervix. It also stops ovaries from releasing an egg each month. So how is it used? It is a subcutaneous implantable rod that releases a daily dose of hormone or progesterone each day. The implanon has an effectiveness rate of greater than 99%. The good part about it is that it can stay in place for 3 years. It's always in place and it does not interfere with intercourse. The downfall about the implanon is that it does not protect against HIV or other sexually transmitted diseases. It is also costly. Another thing is that it requires minor surgery to insert or remove the rod. It can also cause irregular and unpredictable vaginal bleeding, which may be common even after several months of use. The depo-provera is an injectable form of contraceptive. You can receive an injection either monthly or every 3 months. The depo-provera effectiveness is 99%. The good points about the depo-provera injection is that it does not affect breastfeeding. It also does not affect intercourse and can often decrease bleeding and cramping associated with periods. It is also a better form of birth control for women whose compliance with other methods have been problematic. The downfall about the depo-provera is that it does not protect against HIV or other sexually transmitted diseases. It might not get A woman may not get pregnant for several months after shots have been stopped. It also may cause weight change, moodiness, headaches, dizziness, or irregular bleeding. There is also natural family planning, where the woman learns to recognize fertile days of menstrual cycle and no intercourse during the woman's fertile time. There is the temperature method and the cervical mucus method. In the natural family planning, the woman must chart the temperature and or vaginal mucus every day to learn to recognize fertile times. It is between 95 to 97% effective. The good part about the natural family planning is that it is approved by all religious groups. It has a very low cost and can help improve a couple's communication and cooperation, and it can also help when wanting to become pregnant. The downside about it is that it does not protect against HIV or other sexually transmitted diseases. There is also risk of pregnancy if periods are not regular. There are also emergency contraceptives, such as a morning after pill. It consists of a regimen of pills that must be taken within the first 72 hours of unprotected sexual intercourse. There's what's called Plan B and Next Choice, which consist of 2 pills of levonorgestrel that must be taken 12 hours apart and taken within the first 72 hours of unprotected sexual intercourse. Emergency contraceptives prevent ovulation and fertilization, then by preventing implantation and will not terminate an existing pregnancy. Do not confuse with abortion, which is a termination of an existing pregnancy. Plan B has a failure rate of 1.1% if used as indicated. It may be used for women who experience unprotected sexual intercourse, and it is widely and easily available. The downside about emergency contraceptives is that it does not protect against HIV or other sexually transmitted diseases. It may not be effective if the woman has multiple unprotected events or intervals greater than 72 hours. Sterilization is a permanent surgical form of birth control. It can be done on a woman or a male. In women, there is a tubal ligation, which is also known as having your tubes tied, where the sperm is prevented to unite with the egg by permanently occluding the fallopian tube. In men, there is a vasectomy, where the sperm is prevented to unite with the egg by preventing the passage of sperm into the ejaculate. Sterilization is more than 99% effective. The good part about sterilization is that there is no physical effect on sexual desire or ability, and no other method will be needed. The downside about the sterilization is that it does not protect against HIV or other sexually transmitted diseases. Even though it is possible for reverse some forms of sterilization, the difficulty of doing so, combined with the generally poor rates of success and the financial expense, demands that women or couples consider the decision to be permanent. If you desire not to get pregnant, then you must practice abstinence. Abstinence is the only sure way you do not get pregnant. I hope this video will help you better understand the different birth control methods that are available to you. I will see you shortly and will answer any questions you may have. Thank you.